Welcome to Elubacweni, Mount Frere. We are here for, please. We are here for the press conference of the Eastern Cape Provincial Government to provide update on the work that is being done to fight COVID-19. This week, the Premier, together with the members of the executive, are visiting the Alfredo district, where focus is on a number of development programs for all the departments. And I'm not going to specify any of those because the Premier will be talking to that when he delivers the media statement. We would like to welcome people that are joining through YouTube and other social media platforms. We are going to have the briefing, and then afterwards we continue to other programs. If I can please have that door locked so that no one keeps on coming in and out, please. Thank you. So without wasting time, I'm going to invite the Premier to come to the podium so that you can hear from him and have a conversation with him and the MECs that are here. Premier, thank you.
Thank you very much, Mr. Stwesha. Good morning to MECs present here, MEC for Health, MEC for Public Works, MEC for the Department of Rural Development and Agrarian Reform, MEC Math. And good morning to also the Executive Mayor of the district and the Honorable Member, Honorable Dwabu, the HODs that are present and municipal managers, the media houses. Good morning to you all. Welcome to our weekly scheduled press conference on COVID-19. We want to address two important issues today. One is related to our healthcare response to COVID-19, and the other is related to the implementation of government priorities under Alert Level 2. Yesterday, we closed the Women's Month in our province, a month that is dedicated to the struggles that were waged and won by the women of our country who led a revolution against the unjust laws of the apartheid regime. Their resilience inspired us to persevere in the fight against the coronavirus 2019, a pandemic that has visited our shores. Our hope, determination, and hard work during the Women's Month has paid dividends as we have seen a phenomenal reduction in the burden of COVID-19 disease in our province. There's a reduction of the morbidity and the mortality associated with COVID-19. 58% of the COVID-19 cases occurred in July, 27% in June, and only 9% in August. Similarly, 51% of the deaths occurred in July, and 28% occurred in June, only 11% occurred in August. This shows that in the month of August, our people have resisted the virus both in terms of infections and fatalities, as 86% of all the reported cases and 78.6% of the deaths occurred during the June-July period. Our hearts and prayers are with the families of the 310 people whom we lost during the Women's Month. We enter the month of September, a month that is dedicated to celebrate our heritage and tourism. We are in a better footing than we anticipated, as our epidemiological data signals that we are winning the fight against the virus than what was projected by various experts. Various models that were presented by health experts predicted that COVID-19 cases will peak in July and early August, and that under almost all scenarios, hospitals and ICU capacity will be exceeded. Both these projections have been proven wrong. However, we are glad that they were made because they pushed us to work with agility in responding to the virus in terms of encouraging our people to adhere to regulations and health protocols, and adequately resourcing our healthcare facilities to meet the demand of required medical resources and equipment, including hospital beds. We enter the spring season encouraged by the fact that 95% of the individuals who tested positive for COVID-19 in our province have recovered. And all districts have the recovery rate that is above 90%. Just over 50% of the remaining 1,399 active cases in our province are concentrated in the Buffalo City Metro and Nelson Mandela. This translates to 21% per 100,000 population against the 7,096 per 100,000 population we had on the 1st of August. We continue to see great performance in the turnaround times for test results, with 92% available within 72 hours and 65% results available within 24 hours. The number of hospitals, hospitalizations and isolation, and persons on ventilators, ICU, high care, and those on oxygen appears decreasing significantly. We currently have 560 hospitalized patients in our province, meaning our healthcare facilities are not under any pressure. On the 1st of August, hospitalization stood at 942. The decrease in demand has created scope for us to focus resources allocation to strengthen the entire health system going forward. These outstanding results have not just happened by themselves. They are due to the resilience and discipline of the people who tested positive, friends and the families who supported them. They are due to the communities who continue to adhere to regulations of washing hands, wearing masks, and social distancing. They are due to the long hours that have been sacrificed by our healthcare workers on the front line caring for the sick. While we appreciate these results, we are not under the illusion that we have defeated this virus. Thus, we are not ceasing our efforts of completely stopping its spread in our communities. These are imminent threats of our fight against this virus, and these are the reopening of schools, which is a positive initiative that may have unintended consequences. This morning we visited Imakaula. We all know Imakaula became one of our epicenters. I can tell you, from where I'm seated, I'm quite comfortable. I think the situation is under control, the school is focused, everything is actually handled with care. We just met the SGB stakeholders, traditional leaders, and the labor in that school. So I'm quite happy with what I've observed in that school. The Department of Health has a role in supporting Department of Education with effective surveillance systems, monitoring, and public health response. The impact of the sale of alcohol is another threat to the public health services. The sale of alcohol may result in an increased trauma-related cases which may overstretch the resources of the health system and expose patients and healthcare workers to possible infection. The misinterpretation of the level 2 regulation by the public is threatening to spark new. Funa ukubacela abantu bakuthi into kokuba alert level 2 akathi coronavirus iyekile okanye ayisekho. Alert level 2 uzama ukungqina amazwi athi nangona sisilwa nale ntsholongwane kodwa abantu bakuthi mabaphile ubomi babo. Masizama ubuyisela ubomi babo esiqhelweni. Izawufuna ke ngoku abantu abazawuziqoqosha nabantu abazawuziqwalasela, abantu abazawuhlonipha le ntsholongwane bayoyike, bayazi basiphila nayo. Sisenophila nayo futhi unyaka wonke ubheka phambili. Kodwa ngendlela nje siziphethe ngayo, uba sinxiba ezi masks, siyabona ukuintroducewa kwe-mask and they were made mandatory. The drastic reduction in the infection rates improved a great deal. So sicinga into kokuba izasinceda ke lonto ba sizama ukugxininisisa kule nto kokuba nangona kuthotywa amanqanaba okuba sisilwa nale ntsholongwane elizweni, loo nto ayithethi ukuthi le ntsholongwane ayisaphili. Masilumke sisigcine sikhuselekile singabantu. This can lead to emergence of clusters of COVID-19 cases and regrettable deaths. Sibone kakubi asikabikho esinye isifo mna okondazalwa endike ndasibona sibulala abantu aba close to 3,000 apha e-Eastern Cape ngenyanga ezinhlanu. Abantu abebene hypertension, abantu ebebe ne-HIV and AIDS, nezinye izifo, respiratory diseases, ababene asthma, bebengasweleki, bebesenongasweleki for the number of years to come. But because of COVID-19, we have lost so many people who would have lived longer their lives. So i-COVID-19 on its own isiphathele nje enye imeko nje engantlanga, iyafuna uba siyiqwalasele loo nto, siyiqaphele. Yiyo le nto abantu abadala funeka sibakhusele. Yiyo le nto abantu abane-comorbidities funeka nabo bazigade, bazilumkele kule meko. I-comorbidities ke ngomgcineni, ubunomgcineni wakho ozazi ngawo, zigcine ecaleni ukwenzela uba ungabikho phakathi kwemeko yobuzibone usengxakini. We want to remind our people that 2,876 people lost their lives to the virus in our province, and it is still deadly. Isabulala nangoku izolo kukho abaswelekileyo, there are about 16, if I'm right. So the numbers of deaths are still there. We still have about 560 people in our hospitals abasa admitwe. So masiyazi into kokuba ukuthotywa kwamanqanaba ayithethi ukuthi ubomi bubuyela esiqheleni ngendlela epheleleyo. We therefore plead with them not to continue to be vigilant by wearing their masks. We are really pleading to our people, let's remain vigilant by wearing our masks, as I've indicated before, washing their hands and maintaining social distancing. Omasipala sodolophu mabaqinisekise uba amanzi akhona ebantwini. Apho sine problem nezikims ezingaphumi amanzi kakuhle, amatanki, as we have done, amatanki makabe khona, i-tankers mazikwazi ukugalela amanzi, abantu babe ne-access emanzini. So masisebenzisaneni kuloo nto ukuqinisekisa uba abantu bayayenza. Keep physical distancing. Keep that physical distancing. It's going to be important. We are now here working with other people who are not here because of all the technology advancement. But it's important that we keep the social or the physical distancing. Our biggest worry is alcohol users who go out of their homes to drink with friends whose infection state are not known. Siyabacela abantu abasebenzisa utywala bayijonge le meko. Kungenjalo, it will end up in tears. It will end up in tears. You will go out as a young person, enjoy yourself with your friends, come back, infect your parents, and your parents will die. You won't have parents. And you will never enjoy life again knowing that your parents are dead simply because you were reckless. Ubumnandi abugqithi bawuhlala bukhona. Ngeli xesha sisemfazweni masike siyi-appreciate into yoba ubumnandi abugqithi abantu bavunyelwa basebenzise ukonwaba notywala amanani. Siyabona ke bakhona abantu kwiindawo ezithengisayo apho kukho uvula zibhuqe kugcwaliswa imoto ngaphandle uzawuthi umuntu ayakho kwam abantu bahleli phandle. We don't encourage people. We said go and weigh. Yes, iyavunyelwa i-regulation intoba ungathenga usihlasele, but amanani alonto aqingqiwe. So siyabacela abantu bakuthi bancedisane nathi kuba le meko yotywala is a serious risk factor. It's a serious risk factor. It's creating problems ezibhedlele ngeengozi zemoto. It's creating problems kwi-gender-based violence. Apho sibona khona ukunyuka kwamanani okuhlukunyezwa komama ngenxa yabantu abasebenzisa iziyobisi. So we are really pleading to our people. Lento ye social behavioral change is important. Indlela esimaziphathe ngayo masiyi-understand basiphila kubomi bemboleko kubomi bemboleko, because ubomo sikubo bubomo buphantsi koxinezelelo yile COVID-19. So let's really behave in a manner that understands that the war is not yet over. The war is far from being over. The enemy remains invisible. The enemy remains with us. Let's keep it pushing away from us. 95% recovery rate is what all of us would actually smile at. But we don't want even to lose a single life. Nobunye ubomo sobuluzayo ebekufanele ba asebuluzanga iba buhlungu lonto. Yiyo lento siqinisekileyo izibhedlele zinamayeza afanelekileyo bonke abantu bebethatha i-treatment ezibhedlele, izibhedlele ziyaqhubeka zibanika amayeza abo. ESouth Africa akusekho umuntu ubulawa i-HIV and AIDS oswelekayo ngofuna ubhubha. Uhulumende has intervened. We've got the mitigating arrangements that seeks to really mitigate the effects of these kind of diseases. So it's important that siziphathe ngendlela efanelekileyo. I know we have almost had that actually commitment to fight off this kind of a challenge. Siyabacela because babeka ubomi babantu nefamily zabo esichengeni. In the month of September, we are going to focus on 4 things, and these are the intensification of contact tracing and follow-up on confirmed cases. We will ensure that there is an effective implementation of the track and trace system, which were implemented, and the use of the information from these systems. As you know that we had our own data center. We are working with the Department of Health to ensure that we look at all our stats that's coming forward and ensure that our tracing teams on the ground are not demobilized, because we still have numbers every day, even though we are on a decline, but we still have new cases that are coming through the system. Secondly, we will prioritize health promotion, education, and community engagement. We will strengthen risk communication and community engagement using the health promoters and community health care workers to increase the knowledge index of the community. There must also be an increase in the visibility, mass communication, radio, TV, print media, as well as socially. We will protect healthcare workers as a strategy to protect patients and communities through improving surveillance of COVID-19 among healthcare workers and increasing the knowledgeability index of the healthcare workers and managers at the facility level. This will include promotion of the use of PPE. Lastly, we will provide isolation and quarantine services to positive cases and their contacts within 24 and 48 hours to minimize further transmissions. We are now on alert level 2, and this means the business of government is in full swing with the implementation of the priorities that we announced during the tabling of the State of the Province address and during the tabling of policy speeches by MECs of our departments. We have had a 6-month delay due to the pandemic, so we are now going to double our efforts to meet the targets we set ourselves. COVID-19 has shown us that we can achieve a lot when we work together in unison. That is the same ethos we are adopting as we heighten the implementation of our priorities, which relate to healthcare provision, education, agriculture, food security, and economic development, amongst others. We hold this press conference here in Mount Frere because we are visiting the Alfred Zo District Municipality, where we have invested 50.9 million to refurbish healthcare facilities in the district, which will benefit our people in this district and beyond this pandemic. We are at the Matsigane Zulu Hospital, where we invested 332,000 for internal repair work on the existing building and plumbing, which has been completed. There is now space with medical resources for 14 hospital beds with high care beds for the community that is serviced by this hospital. As you know that as izibhedlele zethu bezingenazo i-high care beds, bezingenazo i-ICU, but during this COVID, part of things that were to do in terms of our intervention was to ensure that we bring this service to our people so that our people don't have to drive or to be taken to Mthatha at Nelson Mandela Academic Hospital. Phase 2 of the facelift is underway and will be completed at the end of September. We are pumping in 1.4 million for rehabilitation of existing building to avail space with medical resources for 46 COVID-19 hospital beds with high care beds. We injected 2.1 million at the Mount Aylif Hospital to provide additional space with medical resources for 20 beds, which we will be handing over today. It is done. Completed today as we continue with our program. Later today, we will be handing over this facility, done and dusted. And we have used there the alternative building technology. For phase 1 of the Taylor bequest, 1.6 million to provide building space with medical resources for 20 additional hospital beds with high care beds using alternative building technology as well. Work has started at Spay 2 Hospital at a value of 14.4 million to provide building a space and medical resources for 30 new isolation beds with high care beds of COVID-19. We also want to monitor the readiness of the schools to welcome back all grades to complete the academic year. Inefficiencies in the resourcing of our schools has been exposed during this pandemic in areas of water, sanitation, and poor building infrastructure. Our province is endowed with natural resources, making it possible for us to produce almost all important agriculture commodities. The contribution of the province to some of the popular commodities, such as the red meat and maize, has not pitched on the expected value. The province is producing 40% of non-commercial sector grain and is the opportunity to scale up to commercial level. The red meat and wool sector, the non-commercial Eastern Cape sector, contributes almost 5% of the winners and the wool marketed in the commercial value chains. The agriculture economic transformation strategy of the province seeks to assist subsistence, smallholder, and black commercial farmers to increase agriculture production and participation in strategically identified commodities, grain, livestock, and horticulture. The province is currently investing in excess of 200 million to improve production and increase participation of smallholder and subsistence producer in the commercial value chain. The key food production initiatives that are driven by Dr. Da are 28,600 hectares grain production, maize and soybean, 990 hectares vegetable production, poultry 120,000 boiler beds, red meat, genetic improvement and custom feeding centers, and wool genetic improvement. The special food on household garden production is targeted at indigent households. We have made a total investment in various production infrastructure to the value of 178 million. This investment targets at 450 hectares, vegetable, grain at 400 kilometer fence and storage facilities, and livestock infrastructure at 190 kilometer fencing, 31 sharing sheds, 5 handling facilities, 62 boreholes, and 182 dams rehabilitation project. The Alfred Zo district in particular has the potential to be the grain hub of the province based on ample rainfall and rich soils. In Alfred Zone, a total of 22 million is allocated to plant 6,000 hectares of grain and 6 million for 3,000 indigent households for food production. On the infrastructure development, a sum of 22.7 million has been set aside to improve production infrastructure for smallholder and subsistence producer. The district has been identified and targeted to be developed as the grain and red meat hub of the province. Maize storage infrastructure is the next major infrastructure development in the region. This week, we will hand over 20 heifers to Ongalesnak farmer, 2 bulls to Elopilisweni farmers, and these farmers include former combatants who actually assisted us to liberate this country. We will also join maize harvest day at SCB Kaya farm, where a local farmer planted maize on 50 hectares of land. We will also hand over to beneficiaries the Medeleng livestock handling facility in Ward 16 of the Matatiele municipality, ESEC multi-purpose shed in Ward 19, and Lugelweni multi-purpose shed in Ward 8 of Mzimvubu municipality. All these activities are making agriculture fashionable in our province as a sector that contributes to our economic growth, to sustain jobs and deal with issues of food security. Today, we will also switch on electricity in 246 households in Tlangano village. Ayikhumbula inhlangano nesikhalo sayo ngapha eNtabangulu. Abo bantu basenhlangano namhlanje bawufumene umbane wabo. Siyambulela uEskom ngentsebenziswano. The mayor, as we speak, is switching on that electricity there. We work together with Ntabangulu municipality and Eskom to bring electricity to the community of Ntlangano, who now have access to electricity through our investment. I know that other villages are yet to be connected to the grid, and we can assume those communities that their turn is coming. We are also pleased by the progress we see on the installation of the street lights, construction of the tar road, paving of the main street, and assisting with the development of the designs for the transport hub for public transport in Mount Elif, which we have done through our small town revitalization programs, where we invested about 32 million. These projects are some of the major investments we have made to improve the lives and communities of our people in this district. We are determined to improve the lives of our people here in Alfred Nzo, community by community. As I indicated earlier, we are in the Heritage and Tourism Month. We aim to use the tourism sector to jumpstart our economy. We have comparative advantage in tourism that is premised on the natural beauty of our province and is rich in heritage. In this regard, the tourism sector is one of the sectors that are earmarked to benefit from the 114 million in additional funding that has been made available to boost the economic recovery in the province post-COVID-19. As I closed, I want to make also a very important announcement pertaining to the changes in the administration leadership of the Provincial Department of Health. Our head of department, Dr. Thobile Mbengashe, has resigned from the position of HOD, and he will be leaving the department at the end of September. On behalf of the provincial government, I want to thank Dr. Mbengashe for his service to the people of our province. It was not the first time that he served the people of our province. He has served in various capacities, including the liberation struggle, where he was actively involved in fighting apartheid. We thank him for his service because he used his skill, wisdom, and expertise to serve the people of our province during this work at the department. He supported the province in the development of our provincial multi-sectoral HIV and AIDS strategy through the Eastern Cape AIDS Council. His skills and expertise will be of use in a different capacity from now onwards, as I have appointed Dr. Mbengashe as one of the special advisors to the Premier. He will be playing a strategic role of advising me on how we can continuously improve the provincial administration going forward. The good work we have done in the fight against COVID-19 is because we had him and his colleagues at the helm of the administration and strategic arm of the Department of Health. We appreciate the contribution he made on that front. We want to continue our partnership with the media of providing the media with fresh content on how we are improving the lives of our people and responding to challenges. Thank you very much.
District yangeyo water authority. Okay, thank you very much, Premier. We will now take questions from the members of the media that are here. Let's go. Fundiswa. So sinale microphone lapha, so umuntu xa izakubuza sawucela uba ezapha ngaphambili. Apha kule mic so that izakubuza kuyo. Nansi. Yeah. Mhlawumbi ibeka apha esitikhini enzele ibonakale.
Thank you very much.
Ayicofa apha.
Thank you very much. Premier, the last time we had this kind of briefing, there was mention of lack of PPE and oxygen in some hospitals. Now, we would like to know how far is the problem being addressed now?
Okay, thank you. Mr. Namabong.
Thank you very much, Program Director. Premier, one of the things ethanda ukuba mhlawumbe eyenza into okubana kugcwale ezibhedlela into yokubana abantu abaninzi besuka ezilalini besiya phaa ezibhedlela ingakumbi kule nto ye-COVID-19 ingaba mhlawumbe urhulumente ezi-clinics yintoni ayiprovidileyo in order to deal nale issue ye-COVID-19. Okwesibini, you talking about 14 million if andiphazami ye-tourism ingakumbi kule nyanga ye-tourism. Ingaba mhlawumbe urhulumente wenza njani ukusebenzisa i-tourism ingakumbi kweli cala lase OR Tambo and Alfred Nzo as indlela yokucreate imisebenzi. For years abantu abaninzi basoloko bekhalaza into yoba aside simbone urhulumente kwicala le-tourism esenza nto. Into esinayo nje zi-BNBs abantu badlule balale akho nto iyenza into yoba abantu kutsaleke i-tourism kweli cala. Ingaba mhlawumbi kwiplan yenu ingabi khona into eninayo. Enkosi.
Thank you. Tolo. Abantu bePirates manje.
Good morning, leadership. My question would be, maybe not a question as such, but to the MEC of Health, if she can just respond on the issue of Dr. Mbengashe resigning, if she wants to just share a few words about that. I don't know whether I can ask Dr. Mbengashe as well, maybe to tell us reasons for his resignation. And to the MEC of Public Works, a number of facilities around the province have the challenge of infrastructure, especially in the former Transkei area. I've been to Mount Elif, I've been to Esulenkama, I think he was there as well last week. What intervention is government bringing just to make sure that we don't have these problems resurfacing even after COVID-19? Thank you.
Thank you very much. ikhona enye question?
Enkosi Mhlekazi. Mna umbuzo wami ndibhekisa kwelaa cala le-early childhood. Oh, igama lam nguQaqamba Mdunyelo from Alfred Nzo Community Radio. Thank you. Umbuzo wami ubhekisela kwelaa cala le-early childhood development centers, whereby last week sibone bezawungena kule veki Monday bezawuqalisa i-strike ngemiba ethile bayikhalazelayo. Ndirhalela ukwazi into yobana kwi-early childhood development centers zintoni ezenziwayo ukuqinisekisa into yobana nelaa candelo nalo likhuselekile, ingakumbi njengoba kusazovula izikolo nabantwana siyawazi abantwana abancinci babambi kakhulu. So ndirhalela nje ukwazi lo mba uba izawuthini into nge-early childhood development centers. Thank you.
Okay, thank you. Ikhona enye question? Okay. Mayor, do you want to talk to the tourism issue? No, sawucela uqala ngabo Mayor. Then size SG and then size ngo-MEC. Premier will be the last one.
Good morning to Honorable Premier, Honorable MECs, Honorable MEC Health, Honorable MEC Public Works, Honorable MEC Agrarian Reform and Agriculture. Let me just go straight to the question. We as Alfredo, we have a tourism strategy of how Alfredo is going to be dealt with. Let me say some of the anchor projects that are coming to Alfredo. One of them is N2 Toll Road that is going to be built from Zamba to East London, which will there will be the spin-offs economical that will be coming out there on that project alone. Also, there is another project, an anchor project. We've got a mining project that is in Bizana, Kolobini, that is going to start, and that also will have spin-off on the economy of the district. Besides that, we have got our development agency, which is under, who is doing a good work of making sure that the district has a program that will deal with the economy of the district. Some of those projects is the Beach to Back to recognize the projects from, as you know, that Alfredo is mountainous, and you have got the hiking trail that we are building in Tabankulu that will also bring some of the tourists to come in to Alfredo. Also, besides that, Alfredo alone is one of the most important districts in the entire country because it's where all these legends are born. That Or Tambo and many other leaders that were born in the district. And in that, there's a good program that the district is doing that is called Yazingama Ako, whereupon all those leaders are celebrated so that the future of this district I really am. So ndiyafuna ukuthi nezinye ke programs in partnership we are a district engicingela okokuba yi district ekhule kakhulu kwelicala le-agriculture. So we are in partnership with the department where we want to support i-Red Hub as bekusitshiwo that ngoku kufuneka kube si-creator i-firms to boost our economy, and then all the tourists zizawuza zizobona yonke lento together with abantu base-Alfredo. There's a good story to tell, but the time does not allow. Thank you very much.
Dr. Mengashe, can we please ask you to respond to the question, unless you want to do a one-on-one? The question from the city press. And then after Dr. Mengashe, we're going to request MEC Wago Health, then MEC Matigizela. Then after that, Premier will wrap up. Thank you.
I didn't get the question, but I understand what the issue is. I think what's really important is that we've just had a hectic 5 months to work through the COVID. And everyone was really worried about where the province would be. Actually, when you look at the modeling, one of the biggest challenges was that Eastern Cape was not ready. And you recall that the minister came and worked with the MEC to agree on what would be the best strategy. And that first strategy was to move towards a targeted intervention and making sure that all the clusters for COVID are addressed. And then the Premier, together with the President, together with the Minister, came in Port Elizabeth. They had the report and the plan of the province of what was going to be done. And the President says he was happy with that, and the Minister was also happy. We have been working on that plan and up to now. And I think it's actually, for me, it's an extraordinary leadership from the province, especially the Premier and the MEC and the leadership of the province to really bring us where we are. Everyone was really thinking that we will not survive. And I think we have actually done a good job together with the districts, where I think the best contribution came from the people of the Eastern Cape. I'm quite extraordinary to make sure people of the Eastern Cape not to have ukwaluka go-June for the first time in our memories was an extraordinary part. People of the Eastern Cape not to accept ukuthi babe nemingcwabo emikhulu ukugodusha abantu babo was an extraordinary. There were no weddings in the Eastern Cape during this time. It was an extraordinary. Ukukhusheka abantu ngexesha lokunansika with a funeral. These are really the things for me that I'm so glad that I've been part of the Premier's team to actually work through that. And now we are at level 2. Then we were at level 5. And I think it's the best time for me to work with the Premier now to try and understand how best do we really create the next capacities to work with the next big wave that's coming up. But more importantly, how do we really transform the state in actually creating the agile system? If you look at the infrastructure of the province, there were hospitals that have never seen oxygen. And those provinces, those hospitals that have never seen oxygen, there are communities now that can have ICU in their spaces in the most rural areas. Those are the extraordinary developments for me that are really making sure that the work that has been done by the Premier and the MEC has really made a difference. I think it's true that when you look outside, if you had said to people of the Eastern Cape in December that they would be wearing masks, everybody would have laughed at you. If you had said everyone would be creating a social distance, everybody would laugh at you. If anyone would have said you will be sitting here wearing masks, no one would have believed you. And I think for me, that is really the good work that is actually done. And I just want to thank the MEC together with the Premier and my team who have actually worked very hard to make sure that we're actually doing this work. There is still a lot of work to be done, and I think that work, there are a lot of people in the department who will be able to take these. I am still going to be around to try and assist on those areas that the Premier directs me. And I want to thank the Premier, and I want to thank you, I want to thank the media. I know those days that I had very difficulties, but I also know those days that were very good days in the media. I remember I was going to one meeting, in the Tuesday meeting, and it was one of those difficult days, and I think we've just had the BBC report on Livingston. So I called one of the colleagues here, and I asked him, I don't want to disclose in case you know my contacts in the media team. I asked him what to do, and he gave me some good advice. And I think that advice was that we have problems, we acknowledge them, but we're ready to deal with our problems, and we work very hard until they are completed. Thank you.
Thank you, Mr. Stretcher. Good morning, Premier. Good morning, MECs in the room. Good morning, Executive Mayor. Good morning, my colleague, MPL Travel. Good morning, media at large. Morning, SG and officials who are in the meeting. Thank you very much for the questions. My first response would be on what I would want to stand here and dispute. In the last media briefing, which was in Tata, at Sir Henry Elliott, there was never an issue about lack of PPEs. We have not heard that for quite some time in the Eastern Cape. Only issue one would talk about would only be levels of stock, but not completely without PPEs. So that was not an issue. I think there was a mistake in that understanding. Secondly, I would want to address the issue of oxygen. Maybe you have picked up from what the SG has just said, that seeing our rural areas now oxygenated is a new thing that has been brought by COVID. What we originally were having were canisters. Where we had canisters in hospitals, not that we didn't have oxygen still. However, in this term and time of COVID, the consumption of such oxygen has been very fast than ordinarily. Hence the movement to pipe oxygen in hospitals, both in rural and in big hospitals, to a point that we've started fitting in bulk oxygen tankers in hospitals that we've already seen. One of them is Butterworth, where you've seen it working. We only had one in Livingston, and now we're expanding to almost all. We've got tankers already working in Butterworth. We have tankers that are standing in Tata. We have tankers that are standing in Grey Hospital in King Williamstown. And we're moving on because the assessment on the need of such tankers and the size is still ongoing. And it's a matter that we are dealing with, which of course cannot be done in one day, but still tankers, as they are going to be fitted, canisters are still in the hospitals. There was an issue here in terms of clinics in rural areas. Again, it's good that the SG spoke before me, because part of what he spoke about was exactly the change that we've seen in our facilities. Were it not for COVID, as you all know the situation in Eastern Cape, both of where we come from in terms of health facilities, where majority of the clinics themselves are mud clinics. We've seen some movement because of COVID. We're now able to actually turn around. SG is quite correct to say there was a time that we thought, and everybody thought, the Eastern Cape was not going to make it. When we were being asked about beds and space for beds, and still Eastern Cape was low. One of the things that we actually did, which was a good advice and a good initiative, was to say, instead of building field hospitals, tents, and things, we said, let's redirect our money so that it actually is able to actually give us facility upliftment and rejuvenation and restructuring. That's what we have just done. That is why, as the Eastern Cape, we follow the Premier in boasting about the impact of COVID, though it's not something that we like. However, the good about COVID is that it made us realize where we are in terms of our facilities. And some of those facilities are in rural villages. Nobody would have understood that we would be able to replan unused, dilapidated spaces in health and make them work again. And extend some sections. When you look at Sir Henry Elliott, that was a closed hospital. But today we're able to boast that we're going to be opening our urology section, our oncology section, and in the APT structure that we're building there, we're going to be looking at Burns unit, which is having suffocated space in the Nelson Mandela. We're continuing, whether you go to PE, whether you go to East London, East London has been suffocated in terms of its maternity. The ABT structure there is going to relieve that pressure because majority of people are going in that area. So it does not help us that we are not concentrating there. So our rural clinics, coupled with community structures, have made it in COVID. Precisely because the professional nurses that are in those clinics as OMs, operation managers, are trained in COVID. Hence, you will find that for some clinics, it was possible to even conduct specimen taking. If I were to speak about facilities after COVID, I am linking this with what I've just said. Our aim was to immediately be ready for NHI 26. Remember, all of us in 2026, NHI is coming in. So for us, we've started a route. The last one, Premier, that we spoke about with the Department of Public Works and and Education, is that as health, we're looking at using the closed schools in areas in particular where we don't have clinics. That is in the pipeline, and soon I'm sure you are going to see good out of unused and closed schools. If I were to share words of appreciation and share my feeling about the departure of the SG, as asked here, I would want to go back first to the first day I met him in the department. Remember, I have been working with him as a chairperson of the subcommittee of the ANC in health. But when I had to join the department, it was a totally new ball game. When I got in, he was resigning. Not resigning because it's what, but resigning because it's a new term. I said in front of everybody that I cannot meet you at the door. It is impossible. Much as one understands that in new terms there could be changes, because contracts in their nature are always about 5 years. But when I heard that, I had to tell him and embarrass him in front of everybody and say, I cannot actually meet you at the door, because who's going to take me on in terms of understanding health? And for that, he appreciated and we worked on. He is correct to say there can never be areas where it's smooth sailing, because you come in with an agenda which is political to people who are not having a political agenda, even if their history tells that they are politicians in their nature. But my view is that those are not unusual issues. Where you come into an institution that you don't know and you work with people that you have never worked with, but they are able to both take you in, make you understand health. And my view is that, Premier, the SG is not lost to health completely. In his letter that he has written, he has said this is a move that he is also opening for younger generation to come into the folds and give a space while he is still there to assist and nurture such, which I appreciate. However, everybody may understand in the room, it's not going to be smooth sailing to get an SG at this time who is going to carry on, precisely because it has never been an easy issue to compare apples with pears. It has never been easy to say you have been eating a pear and now you must eat an apple. What's the best approach in eating an apple? But I hope with the assistance of the Premier, it's not going to be a very difficult task for us to get such, which I'm hoping by the time, whatever, we'll be able to get it. But he's still with us for some wrapping up. He's still with us as we'll be even sending that out to say we're looking for an SG. He will still be with us. He's going nowhere except to change officers. Thank you very much.
Thanks, Program Director. Greetings to the Premier, my colleagues, MECs, Chairman, Executive Mayor of Alfrenzo, and everyone here. I think firstly, let me agree with you, Lubabalo Intioba, we have a backlog in infrastructure. Our infrastructure is dilapidating generally, especially the health one, for many, many different reasons. One of the reasons in Dubai, we've got old hospitals, some of them that are 8 years old. If you look at the Silimela Hospital, it's more than 8 years old. It was built using mud. If you look at the example of Sulenkama that you're mentioning, it's more than 8 years old, mud hospital. And generally, if you look around all the hospitals, when we went to Mthatha on our first handover, we had said we'll need a minimum of 800 million just to have at least a break even on our infrastructure to be ready for COVID. And, but to have our infrastructure, especially on health, in good shape, just more than 80%, we'll need not less than 2 billion. There was no money. With the leadership of the Premier, they tried to scramble. Up to date, we have committed contractors up to 595 million. It's not enough, we know. There's still a lot of work that needs to be done, and we've tried to spread all over the province. Here in Alfred's for the ABT that the Premier was talking about, that will be handing over in Mount Elif. The work that we are doing in Sulenkama, I mean, where we'll be going from here, ABT in Matatiele, and a brick and mortar that we are doing. So I agree, you still have a backlog. We still need more money to upgrade our infrastructure. But what I must say, in Dioba, part of everything that we have been doing, the 600 million, when I round it off, that we have spent as the province, we are proud to say we have used more than 95% Eastern Cape-based contractors and SMMEs. We were focused deliberately on grade 3s up to grade 6, because that's a majority of contractors that you find in the Eastern Cape. And they've done wonders. Contracts that normally take 6 months to 9 months, they finished within 3 months, 4 months. They've worked 24 hours, something that has never happened in the construction history. So because of the limited funds that we had, so we were trying to push everything. It's like a living stone. We've turned a parking lot to beds. So we were trying to make sure in Dubai we are ready. We're using every resource to go an extra mile. So we agree, we still have a backlog infrastructure. We've been to Sulenkama no Premier, where he saw himself the condition of the hospital, and he committed in Dubai there will be a phase 2 of the hospital. But there is some good work done there. We've already have good structures that are not necessarily attracting the attention of the media at the back of the old ones. But even the old ones, we are doing something. If you go there next week, with the little resources that we have, at least we have done something. But there's also a phase 2 of a hospital that will be properly built. So we are trying our best with the little resources that we have. I hope I've answered.
It's now your turn.
Thank you very much. I think questions have been adequately dealt with. Nomabonga, you are right there. We have not yet exploited the potential of tourism. And one thing that people must appreciate about tourism is that we market towns, we market cities. So the importance of municipalities to understand that tourism, it is not just an LED unit somewhere hidden. It's going to be important, the municipalities. So the issue of the tourism products, strategies that must be developed, need active municipalities that appreciate that. When you go to London, you will market Mount Frere. Then Mount Frere is in the Eastern Cape in South Africa. And people must understand what is Mount Frere. They will be interested to come to Mount Frere because they have got a picture and idea of what is Mount Frere. That's what tourism is all about. We have not exploited the potential of the mountainous areas. I know we talk more investment on hiking trails, which is along the coast down to up to Port Edward and down to Port Alfred as well. So we've got mountains, yeah? There are a lot of opportunities that are coming up in this side. The heritage and culture. Yeah. You talk about Alfred Nzo, unamampondo, unamaxesibe, unamabhaca, unamahlubi, unabesuthu. Not many municipalities or districts in Eastern Cape are like that. So on its own, it's a unique kind of an endowment that has been bequeathed to us by our forebears. So it's going to be important to look at that. We're working with tourism board to really reconceptualize this out of the normal protected areas or the areas where we normally focus on. Yes, we're still an adventure province. That adventure aspect must not only talk coastal, it must talk inland, exploring. If people can visit Drakensberg in KZN or somewhere, why they cannot visit our mountains here, which can offer the same? So we've got to think outside the box. So we need a kind of a visionary leadership that has got a broader understanding. We must broaden our horizon on the issue of tourism. It has got a huge potential. It has actually been the driving pillar, a cornerstone of our economic development. But municipalities must understand that tourism is not something that you just think about it. It's going to be quite important that you make it your key strategic area as you move forward. But we'll be working with that because we have identified it as a niche in the province. If you talk about development in the Eastern Cape, you can't talk outside tourism. Key to the tourism is our culture and heritage. So we're working around that. So I take your point that we haven't really been a bit aggressive on that space, and we think that tourism is about BNBs and people come and sleep and live. We've got to create quite a recreational space around that and get our people appreciating what we can and showcase our culture and heritage in this part of the province. So those are tourist products. Municipalities must be able to stand up and say, if people come to Mount Frere, Your Worship, Mnokwa, what can you talk about? Where will you take people here? So that as people drive from KZN down N2, can they stop here in Mount Frere? What do they read about Mazigane Gazo as they pass? Do they just say a hospital that has been renamed after that? What is that? What is the meaning of that? So you've got tourists that are cutting right in the middle of your town, but they don't stop. There's nothing that stops them. So these are things that I think as we move forward, we've got to open our minds on. I think a lot, there was an issue of early child development centers. I didn't really pick up the question right, but what I know is that there's a great work that is being done there to prepare ourselves, but we have said, let's have Hamba Kancane there a bit so that we are scared. Many of our grandchildren are staying with their grandparents in Eastern Cape. Parents and others are looking for greener pastures elsewhere. So with this COVID challenge that we're still working on, it will be very risky to be reckless. But I'm not sure about what would have been the toy about as you were raising. I would be keen to make a follow-up on that. I know MEC, responsible for that, she's also supposed to be joining. We can probably leave Alfred Nzo by Thursday, having attended to all those kind of issues. Surely she would know better than me. I've not heard, I didn't get any information around that. I would appreciate it as well as we go out if you've got anything that you can share. But we are attending to every issue, and we have been rolling out plans around that because they are very key in our development of our kids. We have said we need to put more investment in the early childhood, assist our kids at that age so that they develop having been actually well nurtured. That's what we are trying to do as part of us improving our education system in the Eastern Cape. Other than that, I also want to take the opportunity once again to express a word of sincere gratitude to Dr. Mbengashe. Dr. Mbengashe is one of those people who don't have a problem. We have been around, we have served, we have volunteered, we have sacrificed. Even when I came in, that's exactly what he did to MEC. He told me that, Premier, don't feel bad if I don't fit in your plans moving forward. I don't mind. I'm raising this because I know nationally is an asset. He's an asset here as well. So we've got to appreciate that issue, and he has been committed, dedicated, moving, crisscrossing this province, trying to resolve problems of the Department of Health. We're tackling them now, head on, the problems of the Department of Health, and we all say we can't reduce them into any individuals. They've been historical, they've been systemic. We are definitely now looking at that much more deeper to ensure that we resolve issues in the department moving forward once and for all. So we're looking at that, and that's why he's going to be around as well, so that we can always tap into his wisdom moving forward in dealing with the critical strategic issues in the province. So we need everyone in the province. We need media. We need to change the narrative, change the story, report better, talk about what we are doing, not what you think. Because there's a problem of people who always report about what they are thinking and continue with the negative narrative out there. So I'm happy to see you, Kama, again. I know last time when we were in our time, you complained that when are we eating in this visit? We just worked the whole day. I took you to the Msigaba Bridge. You would have never been there if I didn't take you there. You must thank me for that. You know, that's a very interesting project that we must talk about. In this area, we are looking for a sustainable development. We are not juxtaposing the issues. We are looking at a very all-encompassing sustainable development. That's why the concept of the Pondo Park is not also far. It's part of what we are thinking nationally. We had that discussion with them, that Pondoland Park, because we're looking at that. And we know the N2 highway is going to tame the wild coast. It's going to give us those boundless opportunities for tourism to flourish in that space. Our people must understand that it is not about benefiting in the construction of the road. It's going to be more post the road. Those two bridges, they joined the one that is in Tsitsikama to make the third largest bridges in the continent. I'm not sure whether you have visited what is happening in Msigaba. I'm happy that even the one that collapsed at Tendu has been actually re-advertised by Sandral. It's back now. We're looking forward to it. We would want to call upon everyone, every stakeholder. Don't think about yourself, think about your grandchildren. They will thank you. The investment that we're trying to do there is an investment that tries to say, people of Mbizana deserve development in the area where they are. You don't have to go to Marikana for you to get work. If work opportunities are brought in a sustainable way, let's have that. That's why we are open, even on the issue of mining. Let's have a dialogue. Let's not think about ourselves. Let's not allow ourselves to be manipulated and be used by certain individuals who have no interest for our people whatsoever. So we're making this plea, we're making this call to everyone that let's work together. This area has been like this for years. You look at your Pondo revolt, what people of this area have contributed. That Pondo revolt, this is what has influenced even the African National Congress, the governing party, to think about the armed struggle. This is where it comes from. So the massive contribution, it can't be right that every time we bring a development, there are people who simply collapse it, simply because of selfish individual interest. We must actually open up. We must allow. That's why we have said we'll fight corruption. Corruption is an antithesis of progress and development, and it must actually not be allowed in the public space. We can't coexist with corruption anymore. We've got to confront it, we've got to uproot it, we've got to deal with it. People who must be in government must be people who understand that